What if your eyes were consistently broadcasting data about your internal health, even when you aren't looking for it? Why do the whites of our eyes shift color? Or why do some people develop distinct yellowish patches on the skin of their eyelids? These changes, along with shifts happening deep inside the pupils, can act as physical signals for conditions affecting the entire body. Your eyes don't provide a complete medical history, but they often function as a unique focal point for specific health indicators. For decades, physicians have relied on the eye as a primary point of observation. Long before modern imaging, this was one of the only ways to detect systemic issues non-invasively. Most medical checkups rely on indirect measurements. A doctor usually has to listen or feel through layers of skin, muscle, and bone to guess what is happening inside. The eye is the exception. It's the only place a doctor can directly see living blood vessels and the nervous system without an incision. Because of this anatomy, it instantly reflects changes in blood flow, inflammation, and metabolic health. This direct physical connection makes the eye an essential diagnostic intersection for understanding your systemic health. A medical assessment often begins with the sclera, the white part of the eye, which serves as the most accessible layer of information. When the sclera takes on a yellow tint, it points to an accumulation of bilirubin, a sign that usually prompts an evaluation of the liver or gallbladder. Redness is more common and usually results from surface-level factors like allergies, dryness, or a lack of sleep. It is important to note that a red eye is rarely a sign of a severe systemic condition on its own. Most visible changes on the surface are localized reactions, rather than definitive proof of a larger medical issue. To understand what the eyes are actually saying, we have to separate legitimate physical findings from common internet myths. For instance, dark circles under the eyes are frequently cited as proof of poor health, yet they are almost always the result of genetics, sleep patterns, or skin thickness. There is no single visual sign in the eye that can reveal every possible disease in the human body. While eye exams can detect markers for systemic disease, these discoveries require controlled clinical measurement and professional context. Reliable medical insights depend on specialized tools, making a mirror a poor substitute for a clinical evaluation. Moving deeper into the eye, we find the pupil, where the body's internal responses become even more apparent. Your pupils contract and expand automatically in response to light, a biological process that is entirely governed by the autonomic nervous system. Because of this link, persistent or highly unusual pupil behavior can indicate neurological changes, reactions to medication, or the effects of a past injury. However, subtle differences in pupil size can occur naturally, or may simply be a reaction to uneven lighting in the room. An unusual pupil response doesn't provide a diagnosis. Instead, it acts as a neurological signal that tells a doctor exactly where to focus their next examination. To find the most revealing data, we have to look past the pupil to the retina, the DAC wall of the eye. In the mid-19th century, instruments like this ophthalmoscope allowed physicians to project light into the eye and observe the retina surface for the first time. Peering at the retina allows a doctor to observe the active state of the body's circulatory system in real time. Changes in these specific vessels can show the physical impact of chronic conditions like high blood pressure or diabetes. These retinal changes are highly significant indicators, but they are still just one part of the wider diagnostic process. While many eye changes are subtle, certain symptoms serve as urgent indicators that professional care is required. Seek medical attention immediately for a sudden loss of vision, severe eye pain, or a sharp increase in flashes and floaters. Sudden changes in pupil size, unexplained shifts in eye color, or persistent yellowing also warrant a professional review. If any of these vision changes occur alongside dizziness or sudden weakness, they require emergency evaluation. These signs indicate a need for immediate investigation to determine the underlying cause and prevent lasting damage. So, can your eyes explain your overall health? They are one component of a vast interconnected biological system. They offer data, but not the full answer. The eye provides a direct physical portal to the body's interior, allowing doctors to observe health markers that are difficult to see anywhere else. The next time you look in the mirror, consider that your eyes are more than just part of your appearance. They are active participants in your health. Which of these health indicators was the most unexpected to you? Let us know in the comments. This video is for educational purposes and is not a substitute for professional medical advice.